taser does not seem to affect that. We have a couple of studies out there showing that. And so people do continue to breathe during these. What we mostly find is if the exposure time is too short, I think just the simple shock or from the initial taser being applied, people hold their breath. It's kind of like jumping into a cold lake where it's very uncomfortable and people just sort of bear down and hold their breath. So they don't breathe initially, but once they realize they can breathe, they start to breathe, and they do. And so we see that pretty consistently.
All right. So that was, breathing was one of the first things that we tested. Um, then when we had Dr. Kroll on, we talked about metabolic acidosis. So let's get your take on what is metabolic acidosis, why is it dangerous, and why is that something we should think about?
Yeah, from an emergency medicine standpoint, metabolic acidosis is a concerning clinical condition that is brought on by exertion. Um, a somebody who's going to the gym and exerting themselves in a controlled setting, and you're taking rest breaks in between your workouts and things like that, you do get acidotic, but then you allow yourself to rest and come back to normal.